Welcome back to my channel. X-ray, CT scan, MRI all sound like a big machines, right? But have you ever wondered which one looks at your bones, which one shows your brain, and which one gives you the clearest picture of your body? Let's make it super simple. An X-ray is a form of high energy electromagnetic radiation which is used to create images of the inside of the body by using varying degrees of tissue absorption. In this, the denser structures like bones block most of the X-rays, appearing white, while less dense structure like air appears black, with the soft tissue appearing as a shades of grey. These images help us to diagnose the conditions like broken bones, infection, and tumors, and are a crucial tool in the medical diagnostic. A computerized tomography scan, also called a CT scan, is a type of imaging that uses X-ray technique to create a detailed images of the body. It then uses a computer to create a cross-sectional images, also called as slices, of the bones, blood vessels, and soft tissue inside the body. CT scan images show more detail than the plain X-rays do. How does a CT scan work? Let's know it. The patient lies on a moving table as the X-ray tube and detector rotate around them, and the computer then complete the data into 2D slices that can be stacked to form a 3D images. This non-invasive procedure provides more detail than the standard X-ray and is used to diagnose a wide range of injury and diseases. Sometimes they insert a dye called IV or oral contrast to take more detailed images. MRI. MRI scanners create images of the body using a large magnet and radio waves. No ionizing radiation is produced during an MRI exam, unlike X-rays and CT scans. The strong magnetic field created by MRI scanner causes the atoms in your body to align in the same direction, and then radio waves are then sent from MRI machine and move these atoms out of the original position. As the radio waves are turned off, the atom return to their normal position and sent back to radio signals. These signals are received by a computer and converted into image of the part of body being examined. This image appears on viewing monitor. MRI may be used instead of CT scan when organs or soft tissue are being studied. MRI is better at telling the difference between type of soft tissue and between normal and abnormal soft tissue. Next, PET scan or position emission tomography is an imaging test that uses a radioactive tracer to show how organs and tissues are working rather than just their structure. You receive a tracer, typically by IV, that travels through the body and is absorbed by cells. A machine then detects the signals from the tracer, creating a detailed 3D images of your body's metabolic activity to help a diagnose disease like a cancer by showing areas with high activity such as cancer cells that consume more glucose. PET scan is used to diagnose and monitor a variety of conditions, especially cancer, heart disease, and brain disorders, by showing organ function, disease progression, and the effect of treatment. It's often used when other imaging tests like CT or MRI don't provide enough information. Specific uses include detecting a cancer, evaluating treatment effectiveness, and assessing brain conditions like Alzheimer's and epilepsy, and checking for areas of poor blood flow in the heart. Next, USG or ultrasound is a non-invasive diagnostic imaging test that uses a high-frequency sound waves to create a real-time images of internal body structure, organs, offering a safe and painless way to diagnose and monitor various medical conditions. It is particularly useful for soft tissue and is commonly used in pregnancy to monitor fetal development, but can also assess abdominal organ, breast, thyroid, blood vessels, and more. It works by a specialized device called transducer or probe, which is placed on the skin, applying a gel to ensure a good conduct. Transducer emits a sound waves that travel into body, bouncing off internal structures. These returning echoes are collected by transducer and proceed by computer to create images. Because images are produced in real time, an ultrasound can show movement of organs and blood flow through the vessels. Commonly it is used in pregnancy to monitor the health and development of fetus and check for birth defect or pregnancy issues. To visualize organs like liver, gallbladder, kidneys, and spleen to diagnose conditions such as gallstones or enlarged organs can also be used. To examine breast lumps or other tissues abnormality, to evaluate blood flow through the arteries and veins, to check the thyroid glands, and diagnosing joint inflammation, assessing bone density, and guiding biopsies for tissue sampling. All these conditions, the ultrasound can be useful. So next time your doctor orders an X-ray, CT or MRI, you will know exactly why. If you found this helpful, don't forget to like, share and subscribe for more easy medical explainer.